The reason, one, as I have told you earlier, yung para magkaroon ng breathing room. Kasi nangyayari, imbis na patient to doctor, doctor to doctor na nangyayari. Ang direktor ng Ospital ng Maynila, si Director Dr. Lucky, si Vice Mayor Dr. Lacuna, at ang aming Manila Health Department. Now we call this and ask the media to help us to spread and help us deliver the information na starting July 31 up to August 9, ang Ospital ng Maynila ay pansamantalang ipasasara sa mga kadahilanan na marami ang aming mga frontliners ang na-infect at meron din kaming ilang reinfection at marami kaming asymptomatic at marami ding awaiting for test results through PCR swab testing na mga doctors, nurses, medical workers. So for the meantime, sa mga kababayan natin sa lungsod, nananawagan tayo na huwag munang magdadala ng mga pasyente o ng kanilang mga mahal sa buhay simula July 31 hanggang August 9 except matters that involve life and death situation. So to name a few, halimbawa, emergency manganganak. Sabihin, talagang manganganak na, tatanggapin pa rin natin sa emergency room. Yung mga aksidente that involves life and death or anumang klase pang aksidente. So, other than that, hindi muna tayo tatanggap sa loob na nasabing araw. Para naman sa kapanatagan ng kalooban ng ating mga mamamayan na nagdadialysis, tuloy pa rin ang hemodialysis services ng Ospital ng Maynila. Para naman sa ating mga telemedicine na ginagawa ng mga doktor ng Ospital ng Maynila ay tuloy pa rin. Yung ating mga laboratory kung saan meron tayong test swabbing and serology testing, tuloy pa rin. Para sa radiology, tuloy pa rin. So all other things with regard to services of Ospital ng Maynila not included in the extension, for the meantime, suspended yung services niya. Be that as it may, out of 6 hospitals, Ospital ng Maynila, 6 hospital owned by the city and run and operated by the city, tuloy pa rin yung 5 hospital natin. And all other hospitals from the national government. Now, the reason, one, as I have told you earlier, yung para magkaroon ng breathing room. Kasi nangyayari, imbis na patient to doctor, doctor to doctor na nangyayari. then we will sanitize the entire facility ng city.
Mayor, paano ito makaka-apekto dun sa programs with regards sa COVID? Paano ito makaka-apekto?
That's a good question. Those patients inside, no matter what is the cause of admission, like in this case, two things, the regular diseases or other health issues, plus COVID-19 patient. Tuloy lang sila nasa loob na pangangalagaan ng ating institusyon. Sabihin, from there, halt na yung incoming. For example, let's just say a possible COVID-19 patient, hindi na siya tatanggapin muna doon. Kasi hindi naman siya emergency life and death situation. And we have still some spaces, a few na lang, spaces that wherein we can accommodate possible patient of Hospital ng Maynila to another hospital, which is the remaining 5 hospital and 12 quarantine facilities in the city of Manila. And there are different quarantine facilities of Manila. We have quarantine facilities for COVID-19 mild asymptomatic. We have quarantine facilities for COVID positive dialysis patient. We have quarantine facilities for pregnant women COVID positive. And we have people are being quarantined awaiting for results of confirmatory tests done through swabbing.
So Mayor, ilan po ba yung na-infect na nating frontline po doon?
Admitted 11, confirmed cases on home quarantine at 4, and suspects on home quarantine but symptomatic are 32. Close contact, ito yung gagawin. Pag sara natin under the DOH protocol, 10 days. Close contacts of confirmed cases is 58. So, ibig sabihin, yung isang doktor or nurse, meron siyang through tracing and investigation conducted by the director of the hospital and its people, may pre-identified person. So, para makafocus na mapangalagaan ang kalusugan ng mga frontliners natin sa medical sector is to really stop the continuing contagion among themselves. Because I want them to be healthy, emotionally, psychologically, and physically. To give a breathing space for our doctors.
Ano po kayo naging dahilan, Mayor, bakit dumami yung na-infect po natin mga frontliner po doon, unlike sa ibang hospital po?
Well, sa lahat ng hospital meron na na-infect. In fact, may mortality pa sa iba, including the private. Now, your city, modesty aside, is really aggressive in receiving COVID-19 patient. Hindi kasi kami nagtataboy. Wala kayo naririnig sa amin. I know you're journalists, you've seen a lot of stories in some other hospitals na even in the private are not accepting COVID-19. Now, it is the policy of this administration in the city of Manila na kalingahin hanggat maaari. Kasi nga, para maiiwas yung infeksyon sa kanyang mahal sa buhay at sa kanyang komunidad. So, having said that, when we were very aggressive, and we will continue to be aggressive, even with these challenges, we will not stop, simply because to care. So, with that, the effect is the probability of high exposure is there. So, this is a matter of acceptance of facts. It is inevitable. So, that's why, pag medyo sa tingin namin na marireach yung maximum tolerance namin in infection sa aming medical health sector, pag hindi naman natin binigyan ng pagpapahalaga yung mga frontliners who will take care of our incoming and future COVID-19 possible patients, because we know for a fact COVID will stay. We know it already. Every day is COVID day until there is vaccine. Measures are being taken by your local government unit to suppress, not to really, to exponentially unmanageable yung growth. So yun ang trabaho ngayon namin in our own little way. And to do that, we have to take the risk. We are taking the risk. And I'm grateful to our doctors and nurses and medical professionals because they're into our direction. So yun ang posibleng sagot doon sa tanong mo na dahil sa marami kaming kinakaharap at wala kaming tinatanggihan, in fact, modesty aside, this is on the record, even those people who are not from Manila brought here for some other programs are getting infected, are being taken care of the city.